Good afternoon, everyone. Welcome. We are so happy to have you today. Thank you for joining us. My name is Karen Bell, and I'm an Associate Director for Partners for Advancing Health Equity, or the P4HE Collaborative for short. We are a national research learning collaborative that aims to bring together various sectors that are working on health equity, including government, academia, community-based organizations, philanthropy, and the private sector. We are based at the Celia Scott Weatherhead School of Public Health and Tropical Medicine here at Tulane University, and we are sponsored by the Robert Wood Johnson Foundation. Here at P4HE, we bring people and organizations together to better understand critical issues related to attaining health equity. One of the ways we do this is by providing spaces for activities to engage with these groups in insightful conversations on timely topics and to promote actionable solutions. During this quarter, we have done a lot, actually. Our level setting dialogue introduced a working description of political engagement for health equity. We kicked off the quarter by workshopping the description in our interactive learning session. Participants suggested modifications to the description, including involving people with lived experience, changing our mindset from empowering communities to centering communities, and emphasizing that anyone can be politically engaged. In response to your feedback, we have adjusted our focus from political engagement to civic engagement and policy change, aiming for a more action-oriented approach. This new focus emphasizes collaborative, evidence-based, and nonpartisan advocacy, inclusive participation from all sectors and levels of influence, addressing systemic barriers to promote equitable health outcomes, bridging divides and fostering systemic change in health policy, centering marginalized communities with lived experience, and solutions rooted in scientific evidence and community insights. Participants in our interactive session shared challenges, innovative solutions, and identified needs for next steps. Our workshop sprint, which actually concluded yesterday, solidified our shift to policy change by providing strategies for community organizing and civic engagement. In addition to our live programming, P4HE has authored written products to provide examples of and useful resources for driving policy change. Today, we will add to all of that work by discussing how we can promote and participate in civic engagement and political advocacy to affect health policy and improve health outcomes for all with our webinar panelists. The goal of today's discussion is to share ideas that inspire action in this critical time for a healthier society. So, as you know, before we hear from our panel, we want to hear from you. You all have valuable opinions and insights on health equity, and we want those to drive today's conversation. We will be using Mentimeter, which you can access by scanning the QR code on your screen or by going to menti.com on your browser or mobile device and entering the code you see on your screen. So the code is 61854490. I'm going to do the same. I'm going to go to menti.com on my phone, and I'm going to type in that code. 61854490. You can hit join, and once you've joined, you can give us a thumbs up to show us that you are there, you're with us. I see some thumbs up happening. Okay, people are joining the Menti. And so the first question is coming up. It asks, what specific action should we as the health equity community take to drive policy change? What specific actions should we as the health equity community take to drive policy change? All right. This is like an open-ended question, so you can say what you actually think. You can also put in more than one response. So if you see somebody responding and it makes you think of something else, you can add it. This is definitely a collaborative and interactive process. I'm going to do the same. What specific actions should we as the health equity community take to drive policy change? All right. I actually have another idea. So I'm gonna type that in. You can type in multiple responses. All right, let's see what we have here. Define our terms, advocate for Medicaid. Yeah, Medicaid is definitely being attacked. Listening to the community, write bills, involve the community, advocate for universal health care, definitely. Organizing, lobby, and advocate. Our senators and elected representatives speak up, speak truth to power, define goals that matter to the community, partner with the disability community. I like that. Collect and elevate real stories. I definitely like that. You can keep going. Train health profession students in advocacy. Okay, I like that a lot. Work with the community, not for them. Definitely centering the work that is probably already being done in the community. And sometimes that means moving out of the way. Sometimes that means offering your resources, yourself to the work that is being done. I really appreciate that. I think we have some more, or maybe one more response. If you could scroll down. Thank you. Using media to influence public opinion, support other movements, bring poor rural people to the policy meetings to speak on the issues, go to the rural areas and teach people about disparities. Yeah, I like that one a lot. I think some of the changes that we're seeing in terms of benefits, sometimes people call them entitlements, but societal benefits that we have been guaranteed are impacting poor or low income people and rural people most acutely. So working with people in those areas, definitely. Have all relevant people at the table. Thank you. All right. This is great. Thank you so much for sharing your ideas and really continuing to think about what we can actually do. I think we can go to the next slide. Yes. Okay. So the next question says, what tools or resources do you believe are most effective in facilitating policy change in our current environment? I'm going to go to the phone as well, or my phone, and put in my ideas too. What tools or resources do you believe are most effective in facilitating policy change in our current environment? All right. Okay. All right, we have some responses rolling in. You can, take a moment to think. Or if you don't want to put in your response, that's totally fine. This is what you want this experience to be. All right. So what tools or resources do you believe are most effective in facilitating policy change in our current environment? Constant and clear communication. Yeah, I've been in a lot of meetings about, okay, well, what do we do now? And a lot really comes down to like comms and how we are interacting with the public and what type of language we use. Relationships, connections, and rapport, stories, engaging all stakeholders or all participants, active listening, coalitions, relationships, litigation. Okay, yeah, I'm with that. I don't like it, but we need it now. I think a lot of people feel that way. Relationships being realistic, we have to put skin in the game and return to face-to-face interactions with the community, face-to-face communication, laying out the basics, what, why, and how, speaking out for what we want, adopting language of the audience, even if it feels icky. Okay, interesting. Focus on local and state level. Yeah, I've heard that a lot as the advice is to focus on the level or excuse me, on the local level, what's happening in your particular community. Yeah, awesome. Um, Thank you so much. I think that, well, what I will say is that our panelists have been listening to this, and we're definitely gonna incorporate what you have shared into our conversation. Thank you for participating in that Mentimeter poll. As always, we're excited to have you here collaborating with us. Please continue to share your thoughts and comments and questions in the chat throughout today's discussion. You can also do so on social media. If you have any additional questions for the panelists, I just said that, on overcoming current and future threats to health equity, you can submit them through today's event via the Q&A on Mentimeter or in the chat. It's possible that we will not be able to address all the questions during today's live session, but we will figure out how to follow up and address those questions through materials that will be available in our resource library, and circulated through the P4E newsletter. Okay, so I'm excited about this panel. When asked what's the goal of this panel, I think it is to solidify forward motion. And so I want to introduce our panelists. First, we have Jennifer Ito, who is the research director at the USC Equity Research Institute. And we also have Myra E. Alvarez, who is the president of the Children's Partnership. Hello to you both.
Great to be here.
Thanks.
Hello, thank you for having us.
Of course, thank you. Okay, and so what I want to do is ask a question, and it's really a way for you to introduce your work, yourself and your work. But I'll ask, how have political advocacy and civic engagement shown up in your work? I think we'll start with Myra first, and then I'll ask the same exact question to you, Jennifer.
Sure, happy to kick off the presentation, and thank you again for the opportunity to join this discussion. In a room full of public health advocates, I feel like I'm in good company, so I'm looking forward to the conversation and being in this work together beyond it. So I serve as president of the Children's Partnership. We are an advocacy organization in California, and we focus specifically on advancing child health equity, really thinking not only the importance of healthcare access and healthcare coverage, but also the need to address the community conditions in which children are raised that oftentimes limit opportunities for health and well-being. And that's everything from the safety of the community, the immigration status of a family, the economic security of a family, their housing situation, all the very many, as public health folks, social drivers of health that impact our well-being. And when we think about advocacy, there is no advocacy without political engagement. We believe in advocacy and the ability to influence the policy-making process in order for it to be more responsive to the needs of communities, the needs of families, of children and families in California, so that the policies that move forward are actually reflective of what families need to raise healthy, thriving children. So when we thought about this question, Karen, it was, yeah, that's what we live and breathe every day. There is no removing political engagement and political advocacy, right, from our work. So we're grounded in that and really seek to, again, advance advocacy that has connection to real community. Because it's important to appreciate that that doesn't always happen, that there may be pieces of legislation or priorities selected by elected officials that aren't reflective of what community actually needs. You need to look no further than what's happening in Washington, D.C. to understand that it's not reflective of what communities are actually looking for to live healthy lives. So that's the starting point that I'm coming to you with, and I'm looking forward to engaging in conversation around that.
Sorry, you can go ahead, Jennifer.
Sure. So I am the research director with the Equity Research Institute that's based at the University of Southern California. And I a researcher for social change. And so for the past 15 years, I've been a researcher here at the Equity Research Institute, where our tagline is data and analysis to power social change. So we actually don't do the advocacy ourselves. We work with folks like Myra and others who are closer to the ground to actually be the ones to move advocacy and to engage others. But prior to this role, I was a researcher embedded in a community organization and a community group in South LA that did policy advocacy, voter education, coalition building campaigns. So for 9 years before coming to this role, I really was directly involved in research that was related to policy change. And I just want to lift up I mean, something for me, it's very personal. My parents raised me with the belief that knowledge is the only thing that no one can ever take away from you. And that really stemmed from our family's experience as Japanese Americans. You know, just a story, my grandmother was born in Marysville, California in 1915. When she turned 18, her first vote was for President Roosevelt, who had campaigned on this platform of a New Deal, large-scale government action to address the Great Depression. And then in February 1942, Roosevelt signed the executive order that interned Japanese Americans living in the West Coast. So overnight, my parents had to pack everything up and take only what they could carry with them in their two arms, which in my grandmother's case was my mother in one arm and the suitcase in the other. And so I want to raise this because unfortunately, this is very relevant today. And even before our current political environment, it was whether through forced or chosen relocation, through violence, political oppression, or just even high housing costs, building knowledge and converting that knowledge into power to affect change at the societal level has been my life mission. So I'm just really excited to be here and really look forward to the conversation.
So first I want to acknowledge you telling that story, and sharing your personal experience, and your family experience, because I've been thinking about, have we ever been in this sort of context? And I was like, yeah, like not in a broad, whole country affecting way, but for people who who have marginalized and oppressed identities and backgrounds, like you shared, Jennifer, like, I think about my grandparents, like you mentioned your grandparents when you were speaking. I remembered what my granddad would say about knowledge. He would always say, put something in your coconut, saying, get the knowledge, nobody can take it from you. And so thinking about like lessons that we have learned from the past and applying them to our current context. My question, my formal question rather to you all is supposed to be, and I'll read the formal question, but I'll also think about some of the things that you shared specifically, Jennifer, but also thinking about your work, Myra. The question is, how are the lessons that you have learned from whatever experiences that you have had, engaging with policy change and advocacy, how can they help us in our current circumstances? But I think I'm going to rephrase that and say, how have the lessons of your life or your lived experiences or your communities, the communities that you have worked with, if you don't necessarily want to make it particularly personal, how have those lessons impacted how you think about engaging with policy change and advocacy in our current circumstances?
Yeah, I can get us started. I also want to thank Jennifer for that story. I think that it really grounds us in the work that we're doing and is a great reminder of what's happening today and how those realities play out in who we are as people, whether it's in motivation for the work that you're doing every day or the intergenerational trauma that shows up in so many of our community members' lives. So I think when I think about lessons learned and I think about my role as a child advocate, there's this old saying that it takes a village to raise a child, right? It's an African proverb that it takes a village to raise a child. And I think as we've, particularly over the last decade or 15, 20 years, and even before that, we've really moved away from this concept that it takes a village and have really pushed on families this like personal responsibility to take care of your kids and frankly, pull yourself up by the bootstraps, right? Particularly as working parents, whether you're a mother, a father, a non-binary, parent, it is it's moved away from this ability to rely on others in a community. And that's reflective of because we're moving away from our family members, because we're moving into more rural areas or more outside of inner cities where there's less ability to connect with neighbors. And frankly, because of this move towards technology that was especially thrust on us during the pandemic and this constant isolation of being in our homes. And I say that example because growing up, it was the village that raised me, right? Like my mom and dad worked a lot. They had to work 7 days a week. So I would go to my aunt's house and they would take care of us, or my cousins would come to our house and we would swap meals. And I mean, really intimate stuff, right? Like even breastfeeding, right? Like literally. So it was a village that raised us, and it was a village that recognized that culture is healing, right? That there was strength in the culture of my Mexican family to know that somebody had my back. And I say that because those are the values that I carry with me as an advocate, recognizing that it is not one specific advocate that's going to save the day. It is not a child advocate that needs to fight for families. It is not a public health advocate that needs to fight for our well-being, or just to researchers or just pediatricians, that it really requires a village to advocate for children and families. And that intersectional approach to really find ourselves united with a shared agenda for what families need today is what we need, because instead we're being divided and we're being told, let's fight for the scraps. Let's only protect Medi-Cal, when really we need to protect our Medicaid, excuse me, because we're on a national webinar, Medicaid, and we need a comprehensive immigration system, and we need universal basic income, and we need, because that is what families deserve. But it's so easy within our nonprofit industrial complex to fall into these silos. And it takes work to build relationships across sectors, to build trust across organizations that may not have historically worked together in order to stay united. And I think there's so many lessons learned. You know, if you think about the Rainbow Coalition and the Black Panther Party, there was real work to move across ethnicities and races and sectors in order to get people what they need outside of what the government provided, because it was necessary. And those are the lessons that we have to carry on into the work that we're doing today, not only to fight the good fight in this moment, but to lay the groundwork for the decades of advocacy that we'll need to recover from what's happening right now.
Yeah, I absolutely want to underscore what you're saying. I mean, I think right now we're in a particular crisis, and we're dealing with the cumulative acceleration of multiple crises. That I also think is this opportunity. And like what Myra was saying, I think it's this opportunity to really kind of reset the pillars on which our society has been built, to challenge this notion, like she said, of this individualism. We can do it ourselves. We can pull ourselves up by the bootstraps, or we can rely on that one charismatic leader. I think all of that is crumbling. And so what I think we see this opportunity is to really kind of rebuild, reweave our relationships, right? And that's from kind of what we need as individuals, as families, as humans, and what we need in our community. And here in Los Angeles, the wildfires really kind of brought that to bear. And to really realize that there's a lot of mutuality, that there's mutual benefit in these relationships. We cannot do this alone. I think that we have seen, here, one of the things that we learned out of the fires most recently is that there's a lot of abundance. It's there, just the outpouring of support and coming from all different corners showed us that there is a lot of abundance in our community. There is a lot of support. So how can we kind of really lift and nurture this? And so kind of taking this, building off from what Myra's saying around it takes a village, and the work that we've been doing here at the Equity Research Institute is kind of, we developed this notion, it takes an ecosystem. It takes an ecosystem of organizations. It's communities that are most impacted, or they're feeling these problems most acutely, that where we need to center. But they can't do it alone. We can't do it alone, right? We as researchers, and who's going to listen to us in this day and age of misinformation, disinformation, right? And so we all need each other. So I think it is really about how can we figure out new ways of fighting? How can we also make forward movement in ways that make sense for us as individuals, as organizations, and be in greater solidarity or in some kind of united front, because it's all needed, right? We're all getting attacked. How can we do this in ways that are mutually reinforcing rather than what has been what kind of this trend, as Myra was saying, as organizations, we've been siloed. We have to kind of deliver on policy outcomes to our foundations. We have to make progress on these particular issues. That kind of has fueled some sense of competition or a sense of territorialism. I think all of that we can set all of that aside. Hopefully, if there's anything that we come out of this current moment, or kind of how can we do this differently in ways that we have all known we need to do differently, but now here it is.
Thank you. Myra, you first brought up the notion of a village. You know, our collaborative is really all about like cross-sector, not being siloed, collaboration. But one thing that in listening to both of your responses, one thing that I'm thinking about is that some people, particularly people who are like super powerful and high up in their institutions, are using means that we have already done, that, like, you know, using the status quo means, maybe thinking that things are going to go back to normal, you know. And so you're both calling for something new. And so I guess I'm asking, like, how do we convince the people who need to be doing the something new, that is what is required?
That's a great question. It's like a huge question, Karen. Well, I have to say a couple things. I think as an American people, we have really, like, the conversation around the deserving and the undeserving has just really taken off in ways that I think as public health advocates is really dangerous for the well-being of our communities. And with that, there is this growing fear of the unknown for dominant culture, dominant white culture, as our demographics shift in this country, as children become more Black and brown, as immigrants have children in this country and contribute and provide so much richness to our communities. We're seeing this huge backlash and scapegoating of so many communities that are, frankly, the livelihood of our American economy, which was most evident during the pandemic. And this notion of having to of needing to convince people, I really truly believe that we got to go back to the basics. And we talked about this a little bit in our prep, and the responses to the poll talked about this. But it is the need to go back to local community and connection, and recognizing the power in connection as community members, because the dominant narrative continues to divide us and put forward this notion that we are more different than we are similar, and that there's this need to push back against that. And I'm so curious, Jennifer, the research has told us, like, there is data galore that contributes to this conversation. And the translation of that data into action and opportunities for reflection, I think, is what's necessary. And I want to not overcomplicate this, right? Because people are like, well, what does that mean? And what does that look like? And frankly, it literally is connecting in community. How many of us, again, we have moved away from even community centers, right? Like there is no real community center. Many of us are no longer going to church. That has drastically reduced. There aren't a lot of like community coalitions and centers of gathering, right? YMCAs are not as robust. The parks and rec are getting underfunded. Like the core investments that have allowed for community to connect have over decades have been decimated. And again, as we moved into this more isolationism, it has contributed to this division and has contributed to the need to have to convince people. And so again, this is why this intersectional advocacy is so critical. It's not one silver, I don't want to say that, not one perfect solution. It is going to be is going to be a number of different areas that need investment and transitioning from public health to education to criminal justice that will require us to get back at that. But as individuals, we all have a role to play in at least creating those connections at the local level.
Yeah, I think I want to, yeah, we all have a role to play. And I think, I saw in some of the the responses to the Mentimeter, there's like the social media, there's the broad comms, and then there's the face-to-face. And we need to double down on that face-to-face interaction. And I see that through kind of the groups that are doing the organizing or that are committed to working with kind of the communities that are most impacted. It's about meeting them where they're at. It's about servicing their immediate needs so that they can just survive, right? But then it's about how can we move them to a point where they're finding their people, where they're kind of identifying with a base, where then that base kind of can move into different political action in small p or civic action in whichever way that looks. It could be through the PTA or your neighborhood council. I mean, that's where it starts. But there's lots of organizations that are doing that work that don't always get kind of the funding or the resources they need to be able to take folks, move them over time, activate them in ways that put pressure on those that have kind of the official authority, positional power to be able to make decisions that may not necessarily move on their own will or are taking political risks or are taking kind of reading what's possible. It's organized communities that's going to force the change to what's needed versus what's politically possible. So I feel like it's kind of, we all need to be working, we all have a role to play. But I think organizing on the outside, creating the conditions for leaders to have no choice but to align is critical. And so that's where I see kind of the organizing these the robust coalitions that can be advocating, putting pressure, providing the solutions, backing folks who may not otherwise kind of risk their position to take an unpopular, like we need to make those positions popular. And that's on us, right? That's on all of us.
So that was a lot to process, both of your responses. I'm going to let them marinate for now and then ask the next question on my list, and then I'll probably come back because Jennifer, your last couple of sentences sort of responded to this question, but I'm going to ask it more pointedly. Given the backlash to topics that are important to health equity, we can rattle all of those topics off, right? But there's definitely been backlash. That's not something that we can deny. I would ask, what are some practical strategies that we can use to engage in political advocacy to influence health policy at this time?
I mean, I'll start this time. Myra, you've been going. I think it is to take action. I think one of the things to recognize is they're part of the backlash and part of the intended impact of what's happening right now is the paralysis and inaction of it, in just the chaos, to create chaos. And that's already been happening with long-term societal trends we've been seeing in folks' decline of trust of institutions, or all of our institutions are crumbling, or, a lot of folks, nonprofits, governments, corporations, right? Like all of these institutions are starting to crumble. So there's distrust in institutions and anybody of authority, right? I think the other is an explicit desired trend that we have to take action action against, is this notion of apathy and cynicism, and this notion that, oh, my vote's not going to matter. Oh, if I stand up, if I advocate, if I go speak before city council, it's not going to make a difference. Like, that is the outcome, the intended outcome that they want, that folks want. So I feel like we need to counter that. And when you're doing that with others, there is beauty in that. That act in and of itself is transformative. And so I think creating those moments, creating those opportunities, and however it makes sense, given kind of, your individual position and circumstances, I think the first thing is to take some kind of action, because that in and of itself is a radical step against what we're up against.
Yes, I could not agree more. And I think in speaking to a room full of, again, public health advocates, I think there's something to be said about the connection between civic engagement and participation and mental health. The ability to enact change and believe in the power of our voice and our ability to contribute is a mental health intervention, and needs to be considered a mental health intervention. We hear this all the time from our youth mental health leaders, from our youth leaders that are saying, listen to us, we have agency and we know what we need. And that in and of itself is a contributor to their more positive mental health in today's, very challenging time for young people. So again, it's not only this opportunity to impact your community well-being, it's frankly an opportunity to impact your individual well-being by stepping into your own power and being able to participate. So again, talking about advocacy and civic engagement as health interventions is such an important opportunity to bring sectors together, to show that the power of intersectionality and influence for what we can do together. I also think there's something about a recognition that organizations, institutions, nonprofits, community organizations, we all are on some spectrum of advocacy, and that there is an understanding that not everyone can lean in the same way. And I say that with some, as a child health advocate, many of our very dear partners rely significantly on federal funding, rely significantly. I'm talking about Head Start centers that are taking care of some of our most marginalized communities of children, that they are now hands tied. If they want to keep their doors open, they are limited on things they might be able to say, and think like might need to change some words up. And rather than, and I don't want to use this word, but I can't think of another word, rather than demonize organizations that may have to do that for their own well-being, let's have an understanding that that continuum is what we need in this moment to build a broader movement, and welcome everyone, recognizing that we all have to be somewhere along that continuum. And organizations like mine, we're much smaller, we don't get any federal funds. We can lean in and be that much more of allies in this time that hopefully will strengthen the capacity to respond to these attacks on public programs, these attacks on so much of the livelihood that, families need to, again, raise healthy, thriving children, or to live their lives, period, right? So that's a couple of things that come to mind in that question, Karen, and don't know if that sparks others.
Yeah, I was literally going to ask the question, that you already just responded to. I was going to say that, like I mentioned before, our collaborative is cross-sector. And when we were thinking about who to have on this panel, the idea of having someone from a governmental, entity sort of like out of the window couldn't happen. Even as an academic myself, I sometimes find myself questioning, what can I say? Teaching online, I'm like, oh, can I have this recorded? Ultimately I end up saying, what I want to say and using those words. But I do recognize what you're saying about some groups or entities or organizations being limited during this time. And so what I'm wondering is about like a potential power shift, or maybe not, that's might not be the word that I want to use, but a shift in who is able to do the most forward work at this point. That's not on our list of questions, but I'm wondering what you all are thinking about that, Myra, because you said you work at a smaller organization that doesn't get funding, like who can we look to for leadership? I think that's what I want to ask, actually. Who can we look to for leadership in political engagement, or rather civic engagement, and advocacy at this time, noting that it should look and has to look different? Who can we look to for this work?
Yeah, I'm happy to start on this. And I actually want to build off of Karen, some of your comments earlier, where you're like, there isn't one person, there isn't one organization. I think what we have to look to is the power of movement, the power of coalitions, the power of coming together in unity and solidarity to demand better for our communities. And, again, as a nonprofit, someone who is highly reliant on foundations, it's this very challenging notion to explain that relationship building is progress, that trust building is progress, especially during a time where there is so much distrust and there is so much, the pie is getting smaller. Let me, stick to our niche. No, like this is the time where we got to lean in to solidarity and coalition building in order to be stronger for the movement. And that not only includes like organizations, but this opportunity, to Jennifer's point, of community organizers, and recognizing the power of community leaders and investing in organizing that enables, local kitchen table conversations about these topics and opportunities for engagement. And that those topics of conversation are then connected to a shared unified advocacy agenda, right? Because I also want to make clear that it's not only defense, it's not only pushing back against this federal administration, but it's also taking this opportunity to see what more can be done at the state and local level. And I want to recognize it's within the limitations of our difficult economy and all of those circumstances, but there has to be an alternative that we tell people exists. And be able to paint that picture that demonstrates, what a safety net looks like for all of us that are struggling, all of us that, we're from California, so it's really expensive to live in California, but it's really expensive to live everywhere right now. Let's make that clear. And whether you're a person of color or you're white, whether you're in a rural community or an inner city, like you are struggling. Many of us are struggling. And so how do we find unity in that, when much of what this administration is doing is focused on corporations and billionaires that are not in touch with the experience of everyday people? And again, that painting of a different picture is an opportunity that I think we can lean into in order to do better.
Yeah, I think, there's some folks that need to be on the front lines on the defense, right? And so how can we support them? How can we also be be letting them cycle out to rest, right? Everyone is exhausted. So how can we be intentional about, okay, who steps in front? Who can lead that charge? How can we swap them out? How can we let them rest, let them come back, right? Because this is a long haul fight. We don't want to burn ourselves and others out in this process. And then at the same time, yes, also be thinking about kind of the longer term, like what are these longer term things? And what are the proactive things? What are the things we want? Not just what are the things we don't want? So I think, there's different organizations that are in different places where they can be on the, different roles at different times. But I really do think that being in relationship, being in conversations, it is really hard right now when we have learned how to do so much virtually, and it's great that we can be in this virtual environment and reach a lot of folks. But I also think that kind of the in-person convenings, coalitions, where a lot of that informal conversations can happen is also critical. That's kind of the glue to the trust. And so I think having those conversations to understand, okay, this is what I can do, this is what I can't do, and more of understanding how we're all fitting into this long-term, larger march towards a world we want, versus what so much happens is that we criticize those that are like closest to us because they're not standing up, they're not putting out that statement, or, so I just think that agreeing that we all have a role to play in the civic engagement. And it's just going to look different for different organizations, for different entities. But how can we kind of keep our eye on the long-term horizon and be navigating, but kind of all still be marching side by side and for the long term?
Thank you both. Interestingly, Myra, your response was going to be my next question again, but that's totally fine. I also was going to say, no, it's great. I appreciate both of your comments. I was also going to note that, our audience has been a little quiet, but I think we're all just taking it in. But we do have a question from an audience member that asks, how can we measure the effectiveness of policies aimed at reducing health disparities? I think you can answer that however you want.
I'm gonna let Jennifer go. As a researcher, I'm so
Yeah, this is like it's always about the measures, and I think it's really good to define these because people, and I used to have this love-hate relationship with metrics, and now I'm like full on embracing it. But I embrace it because I think as much as you can define those, different folks will have different strategies to get there, or the paths will look differently. But I think if you can measure it, and so for me, I think about how do you measure the success of a policy in health outcomes in different ways. One is just, how many, who is it affecting? How many different types of people? Or what's the scope and scale of the problem that it's solving, and how effective is it in solving that? So one, in some, but I also want to say, and this may be relevant in this particular context, sometimes a policy victory is just even getting the issue recognized as a problem, which it can take years to get that. It can get years for folks to even recognize that, oh yeah, this, whatever, pick your issue. Oh yeah, that's a problem. That's something that we as city council or county board of supervisors or as Congress is something that we should take up. Like sometimes that is where, given kind of the context, that in and of itself is a policy victory. And I want to say that in particular for the foundations that are on this call that want to see policy outcomes, you have to be in conversation with those on the ground because it's going to look different in different places. The policy may need to look different. Just what's considered a win may look differently. And even once you pass the policy, it's the implementation. It's working with the government agencies, having the feedback loop with the communities and the clients that are supposed to be beneficiaries. That is a whole nother set of measures and metrics. So I'll hand it over to Myra from here.
Yeah, we can't do emojis, so I can't like respond, Jennifer, to what you were saying. I wholeheartedly agree, and again, we're coming from California, where on paper you can look to so many of our incredible policies and be like, wow, you're really doing it. But you look at our outcomes, and it's not showing up. And you look at people's understanding of policies, they're not even aware of some of the rights and benefits that they have. And so there is a number of opportunities to evaluate our progress. And it's not just how many people have signed up for this program. It's not just the widgets. It's really and also the qualitative experience of many of the, for at least in our work, many of the public benefits that we make available. We lead a multiracial, multi-sector coalition focused on early childhood development. And we've done a lot in the state of California to focus on early childhood equity and to strengthen our Medicaid program and to do universal, transitional kindergarten. And yet, when we do listening sessions with families, they do not even feel dignified walking through the doors of a county office. Like the lack of human dignity that people experience. So, like, where does that progress measure factor in to the experience of accessing public benefits? And that actually stems from, to Jennifer's point, the opportunities for agencies to have a feedback loop with community members. What is the level of engagement of actual recipients of services in the development of policies or in the progress of implementation? And do we have that as a standardized commitment as public agencies? And this is tough work. I don't want to just like roll it off my tongue and say, come on, do this. But it's necessary work, especially with the incredible work that goes into enacting legislation. That's just the very first step. And it comes up time and time again, at least in a state like California, but I'm sure it happens across this country where the actual experience of end recipients is not considered enough, as we tend to not invest in implementation of policies as much as we do as getting them across the finish line.
Thank you. I think for my last question, I want to ask kind of a difficult thing. Jennifer, you brought up this idea of this being a marathon, which I agree with, but I think that people are feeling so distressed, and that these are very acute changes in our country and our society, that people might be looking for something more immediate. So if you could think of like a word or a phrase to describe what you would want with regard to this topic, and like immediately, like today or tomorrow, what you would want with regard to civic engagement and advocacy, what might that be?
You said one word, so I'll say joy.
Oh, I am so bad at one words. I mean, I would say solidarity. Like, and I believe that there is joy in community. There is joy in connection.
Yeah. Awesome. Okay. Well, thank you both really for being here, for sharing your wisdom and your insights. Like I said, in the planning process, I wasn't sure what would come out of it, but I think what has come out of this is definitely next steps forward, and is inspiring to our audience to feel empowered to do something about where we are in our society. So really, thank you both. Great. Thanks. So as we close this webinar, we'd like to learn from you about how practical and applicable to your work the conversations we've had today are. So we'd like to invite you to fill out a short survey that you should be able to access through a link in the chat or by scanning the QR code that you are seeing on your screen. So link in the chat, I'm going to do that. The questions are pretty straightforward, just your name, email. You don't necessarily have to do that, but these are questions about how relevant the content is to your work, how it has impacted you, how it's expanded your perspective. Any other comments that you want to give, you can leave them in the chat or maybe even email us. Also comments about how you can use this information. So yeah, go ahead and take some time to fill that out so that we can be responsive to your needs. With that, we want to conclude our session today and invite you to join us for the next year, for our next events. Sorry about that. So we are having a film festival here at Tulane in our Celia Scott Weatherhead School of Public Health and Tropical Medicine. We have a new name on April 6th, our Breakthrough Health Film Festival. The QR code is on your screen for that. It's an inspiring showcase of storytelling through film that promotes health and wellness, aiming to spark conversations, foster understanding, and inspire action towards a healthier society for all. More information about all of our upcoming activities is available on the website. You can also join us for the P4HE learning session on combating information and advancing truth telling, which will be on April 30th at 1 p.m. Central Time. You can follow us on social media and help us spread the word by sharing our content that most interests you and your work. Thank you so much. See you all soon. Bye-bye.